Hi, I'm Yong Hao. I'm 42 years old this year. I'm currently a lecturer at a polytechnic in Singapore. I'm living with hereditary angioedema. But the first time I experienced sort of an attack or episode of hereditary angioedema, or in short HAE, was when my right foot was swollen. But that was when I was about 21, 22 years old, I think 21 years old, after my national service. Right, it got swollen out of the sudden one day. I couldn't really put on my shoes. I couldn't really work. So I had to go to the hospital and I was admitted. And they need to extract, I think they were checking, taking some bloods, trying to figure out what might be happening. Right, so that was the first attack. It wasn't painful. It's just swollen. Right, I can't really walk properly. I can't really put on my shoes. So I was in the hospital for 2 days. They were doing a series of tests. Just took blood. I think they also took some fluids for my swollen foot. Right, so that was the first attack. I only got my diagnosis of HAE, I think 14 years after my first attack, right? So 14 years I've been counting, right? So this is quite typical for a patient with HAE because it's relatively rare. Most doctors do not know about, right, HAE. So the symptoms, they usually looks like somebody with gout, right, or somebody with rheumatism or arthritis, right? So that's usually the first thing that the doctors will think about when they see swollen hands, swollen feet, right? So that was actually the initial diagnosis, right? So they were thinking that it might be gout, right? So, but I think in the test that they were running, they can't find the crystals, right? So if you have gout, then in your fluids usually have some crystals. So they can't find it, so they were suspecting, right? So, but I was given gout medication for quite some time. I guess close to maybe 10 years, right? Before I see it, in the same department, I see another doctor. So she's suspecting maybe it's not gout, maybe it's some form of arthritis, right? Then I was put on another type of medication, more like a type of steroids, right? So like I mentioned, this is quite a typical journey for someone with HAE because the symptoms looks like other more common conditions. So you usually get what they call a misdiagnosis. Then you get this long journey of seeing different doctors for different things until you finally get the diagnosis of HAE, right? So that would be my journey. So before I got my diagnosis, so really gout and arthritis, some form of rheumatism were the diagnoses that I had before I was formally diagnosed. As far as I can remember, I usually have 3 to 4 attacks a year, right? So in between maybe 3 or 4 months before another attack comes. And the attacks for me usually happens either at my feet or my hands. So they get swollen, right? Most of the time, if I don't do anything about it, I can't do anything about it because even before I got my diagnosis, I'm not sure what's happening, right? So if I have steroids, I will usually eat the steroids, but it doesn't really help me relieve the swelling. So it will take maybe 3 to 4 days before the swelling goes down. So the interesting thing about the swelling, especially if it's in the hands and the feet, right, is sometimes it will move around. So what it means is I might start off with my right hand, it gets swollen maybe all the way to close to my elbow. Then it will go down maybe in 2 days. Then the next day, my left hand will start to get swollen, right? So it moves around, right? So that's actually one thing that I probably didn't really tell my doctor about it, right? Because when I have the attacks, I don't get to see them, right? So that's the thing. So I get 3 to 4 times. Each attack lasts maybe 3 to 4 days, up to 5 days. If it's in my hands, I can still move around. If it's on my feet, right, usually it's hard to move. It's not painful, it's just that when you put it down, it's just hard to move around, right? So I would say 3 to 4 times a year, yeah. I think one of the turning point, probably 1 year just before I got my diagnosis, is I was seeing another doctor. So she was ruling out gout, right? And I think she was also ruling out, it doesn't seem like it's arthritis. And the reason why she was ruling out all these other diagnoses was because I started to take pictures of when I get swelling. I think previously, usually when I'm having an attack, I don't get to see a doctor. So when I see the doctor, I'm usually quite normal. So I can only describe to the doctor what happened. If I don't record it, I don't really remember, right? So what I did was I just started recording. So on which day or what time when the swelling started. Then I take photos. This is at the start. This is at the maximum, right? How long at the end of 4 days, this is how it looks like. So I started to show the photos and videos and records, my written records to her when I see her, and she started to rule out all these other diagnoses. But she still don't have a good idea what might be happening to me, right? So what I did was actually, once I know that it's not arthritis, not gout, I go and did some research on my own, trying to figure out it. I found about this, right? I read about this condition, HAE, right? The symptoms, some of them do look like, sounds like what I'm experiencing. So could it be that I'm suffering from this? Right, so she said, might be. So she did a test, she ordered a test. Actually, that test is not available in Singapore. So I need to take her blood and they need to send it over to the US, right? I believe that's the case still, right? Anyone in Singapore who wishes to be diagnosed, they have to take their blood and the samples have to be sent to the US. It's not cheap, a few $100s, right? So I did a test, came back, right? Then yes, it indicates, the test results indicate that I have HAE, right? And there are different types. I'm the type 1, which is very low levels of something that I'm missing in my blood called C1 inhibitor, right? Esterase inhibitor. So this is something that is actually, I have a deficiency in. So that's the thing that is causing me to have all this swelling, right? So came back, doctor told me, so I think the first thing I experienced, or what I felt the first time I heard about results is relief, right? Because, oh, finally I know what's happening to me, right? And as I find out more about this condition, and I know that so as the name implies, it's hereditary. It was passed down, right? My mom had the condition, right? But she don't really have attacks. So I got the condition from her, right? So once you know that, it's something that is hereditary, right? It's actually, it's not anything that I'm doing that's actually triggering all these conditions. So once I know that, then I guess I got this relief that actually it's not something that I'm doing, right? It's just passed down. I'm missing something in my body, right? And actually there are some medications or treatments out there that actually can help me manage my condition. So that was the first feeling relief. Then I guess for the immediate period, few months after that, once I'm on the medication, the first time I don't really experience any attack. I think for the first 6 months, before I see the doctor again, I'm on that treatment and I don't experience any attacks. So that was the first time I felt that my life was sort of like back to normal, right? So in Singapore, the main treatment option that is preventive in nature is this attenuated androgen, we call it danazol, right? So I was on it since my diagnosis. So since it's an attenuated androgen, it's like a male hormone, so it's not really, it may affect females as well as young children a bit more, in terms of side effects compared to someone like me who's a male, right? So I think once I am on the treatment, I was actually essentially attack-free, right? So for a long time, I didn't really experience attack. For pretty close to 2 years, I was not really having any attacks. So it's like I'm living a normal life, except taking the treatment itself, right? And for the condition, there are actually a lot of other treatments. So I mentioned danazol is the main one in Singapore, but there are actually a lot of other treatments elsewhere, and more, I would say, modern treatments, right, that have actually less side effects. They are also more suitable for children, younger children and women, but they are currently not available in Singapore, right? So in Singapore, for preventive purposes, danazol is the main one, right? The other treatment is more a treatment when you have attack, and for you to sort of like alleviate the attack itself, right? This treatment is you can only receive it in the hospital, right? I think in Singapore, as far as I know, only 2 hospitals have that treatment. So if you have a HAE attack, right, and some of the attacks, not like the ones in my hands and in my feet, there are other attacks in the gut, the abdominals, the abdomens, or attacks of the face when you have your face is swollen, or the worst type of attack when your throat is swollen, right? So for those types of attacks, the one in the gut, they are very painful. I have not personally experienced them. I have met other patients who have experienced it before. Usually it's very painful. Essentially, your intestines are swollen, right? So they will feel the pain. For those, they will probably need to go to the hospital and receive that treatment that's only available in the hospital, right, to relieve the swelling. If you have it in the face or in the throat, right, the potential danger of that, especially the throat, is that if it swells until it fully closes the airway, you will die from suffocation. I had a throat attack once in a few years back, 2019. That was the time, like 2-3 years, I was attack-free. Right? I was on the treatment then as well, I was attack-free. Then the doctor was saying, okay, maybe let's see whether we can cut down the dose, because ultimately it's still a androgen, it will still have side effects. So he's trying to cut down to see whether I can go without the treatment and still not having any attacks. But the issue at the time was I was off treatment for I think about 1 month. Then I had flu, and the flu actually triggered the throat attack, right? And I had to go to the hospital, right? I was thinking it was just a sore throat, but it got swollen, more swollen. Then I started to have difficulty speaking. I can't really speak, right? So I immediately went to the hospital and get that treatment to relieve my swelling. So they have to infuse it into my body. And I remember the episode very well because I can't talk. I go to the emergency. I was at the triage. I was telling the nurse, actually I can't tell. So I was typing into my handphone and telling her, right, I have this, right? Please contact my doctor. She will tell you what's happening to me, right? I need to get this treatment, right? So immediately I was pushed into the research room, and the doctors were examining my throat, and they ordered that treatment, right? But I guess at that time it was very rare to have a patient coming in with that condition. So the pharmacists and the nurses actually don't know what to do, because they need to mix, they need to take my weight, they need to measure how much I need to be infused into my body. So it took quite a while before they actually start infusing it. And I was admitted to the hospital for observation. I was out actually in 1 day. It went down once I get the treatment. So there are many, I would say for a rare disease like HAE, so it's rare because I think the prevalence, at least based on whatever we know now, is about 1 in 75,000 to 1 in 100,000 people, right? So it's relatively rare. So for a rare disease, patients with HAE, right, are actually very fortunate that there are a lot of options, treatment options available. But the unfortunate thing is it's not really available. All these options are out there, they're not available in Singapore, right? So there are treatments that have a lot less side effects compared to danazol. There are really, I think, very, very recent treatments that are orally taken, right? You can just eat them, you don't need to infuse, you don't need to go to hospital where they need to set up a IV for you, right? So they have all those treatments available, but they are elsewhere, but not in Singapore, right? And I think I mentioned also for young children and women, they usually can't take danazol because they either, for younger children, it might affect their development. For women, they will experience a lot more side effects compared to men. So it would be good for these treatments to be available in Singapore, right? I guess the challenge would be, since it's a rare disease, so the number of patients in Singapore, I think very few, less than 30, about 30, I guess the diagnosed ones, right? So for a pharmaceutical company to want to bring into Singapore, they have to go through all the issues, right? All the registrations and stuff like that. So it might be harder for them to decide to go through it, right? Unless there's enough demand. So I think for the immediate future, all these treatments are more difficult. It won't be coming in so soon, right? There are options available. I think that's a good thing, but they are not accessible at the moment in many countries, including Singapore. And even if they're accessible, they will be very expensive. In Singapore, I have been in touch with the Rare Disorder Society of Singapore. So when I reached out to try to find other HAE patients in Singapore, I managed to talk to someone from Australia, right? And this person actually is part of a larger patient group, an international patient group, HAEI. Right? So I was in contact with her, and she was coming to Singapore, and we had coffee, right? So she was saying, okay, let's try to see whether they can get HAE patients in Singapore together. And maybe we can also speak to other groups in Singapore to see what kind of advice they can provide. So RDSS was the group that we actually spoke to at that time. We were talking to Mr. Kenneth Ma, right? He provided a lot of useful advice, like for people with rare disease in Singapore, right? What are some of the challenges they're navigating, right? So based on that, I sort of like signed up as a beneficiary with RDSS, right? So they actually provided a lot of opportunity for us, patients with HAE. So I think the first one came quite fast. After I was talking to him, I think Kenneth was saying, hey, there's rare disease feature on TV, right? So it was mainly on rare disease, but they were looking for people to see whether they were okay to appear on TV. So he was asking me, do you want to go on some of these features? It was in Chinese, right? So to just talk a bit about HAE. So I would say, oh, why not, right? So I get some exposure for the disease. So that was the first time I think we as the condition itself, we sort of like have some exposure in the media, and it opens I think from there, because I was seeing the doctor from that particular hospital. So the group that did the feature also went to the hospital and like sort of tried to talk to the doctors, and the hospitals were also doing their own communications, right? So releasing certain things. So it led to a few things being released. So in that year, I think in Singapore, at least there was a short video of me, part of bigger feature, right? There's some newspaper interviewing the doctors, talking about the condition. So at that point of time, there was at least some media activity. So RDSS actually did help us put at least HAE patients, right, in the media spotlight for a while. So I guess would be really for someone with HAE, being in a group that actually advocate for rare disease in Singapore is one thing. Giving opportunities to appear in different, hopefully, media outlets to raise awareness is also something that RDSS has been actively sort of helping for patients with HAE. My family, I have a wife, I have a daughter who is 6 years old this year, right? They are very supportive. They know my condition. Actually, my wife do help out sometimes with some of the public awareness activity, right? So I do get her to help, right? And she's very willing to help. She understands that it's important because it's rare disease, right? To let people know, right? It's always better for more people to know. And I have support from my co-workers as well. I'm actually very open to share about my condition with people that I meet, right? In my workplace, I will tell my co-workers, I join a new company, then I'll tell them, oh, I actually have this condition, right? What will happen when I have this, and it's very rare, and what I'm doing, when I interact with people from different countries, this is what is happening to them. I'm very fortunate to have it more managed, well managed than other people. So I do share, right? I mentioned I'm currently teaching in one of the polytechnics, right? So at the start of every class, I will also tell students I have this condition. So it's just so I just take any opportunity to just share with people the condition, right? Hopefully to any opportunity to just raise awareness for the condition. I think contrary to what a lot of people think, most people don't really, at least the ones that I have shared my condition with, they are usually curious. They want to know more, right? Because by looking at me, you look quite normal, but you actually have a condition. So they are usually very interested to just understand a bit more. And they find it very interesting that, there are such condition, and people don't really talk about it, right? So I'm actually very glad that my sharing has been quite positively received. So I get support, I get understanding from my co-workers. So one of my main worries, right? So since it's a hereditary condition, so there's a chance that I pass it down to my daughter, right? So I haven't really tested my daughter. So when she was, I think when she was born, and I was speaking to my doctor was saying, okay, don't have to test at such a young age because the body, I think the system is not stable yet. So if you test now, the result wasn't really conclusive. So just wait for her when she's older. Of course, another concern is also whether having a diagnosis, right, will actually affect whether we can get insurance, right? So that's always the key concern in Singapore. Any type of condition, then you're worried whether you can get insurance, right? And because it's so rare, then insurance company might not know how to handle it, so they might just exclude certain things, right? So we have been holding off the testing, but we are already thinking about testing her very soon, since she's going to primary school very soon. So the only worry is, okay, does she have the condition, right? And as I mentioned, in Singapore, young children and women, right? So she's like both, right? So the current treatment really not suitable for them. So if she has the condition and if she manifests, right? They can manifest as, the attacks can come as young as 7, 8 years old, right? But most people, they might only experience it during puberty, 13 or 14 years old, right? So if she does have attacks, I'm really worried. So my worry is about if she has condition and she has attacks, actually there's nothing for her now, right? So that's my worry. So actually that's one of the main motivating factor for me to actually try to see whether we can raise awareness, work with other people, right, to see whether we can bring some of the treatments that are more suitable for younger children and women into Singapore. So that's one of the things that also got me, or at least continue to work in some of the advocacy work for HAE. So the lady that I met from Australia, she is part of this group called HAEI, right? So she was asking me, oh, do I want to maybe just help coordinate some activities for HAE patients in Singapore, right? So I say, okay, why not? Right? Of course, she pitched it in terms of just look at the emails and reply to any emails. I said, oh, that's quite an easy job. So I don't mind helping, right? So I was doing it for some time. Then not really a lot of things happening, right? So in Singapore, because there are so few patients, I'm trying to reach out to as many of them as possible, really just to keep aware of what's happening for HAE in Singapore and anyone with any questions, right? Then I got a bit more involved in the international or regional work when I was asked to help out with supporting patients also in other countries. So each countries usually will have one or a group of people who are looking, sort of like doing advocacy work for patients in the country. But for HAEI, which is more international, they will have people in each region to sort of coordinate some of this or support some of these efforts in terms of resources or information resources, or even just making sure that somebody that they can turn to for advice. So I was sort of like offered this advocacy work. So I started about close to 1 year now. So I was just supporting countries like Indonesia, Malaysia, Hong Kong, China, Taiwan. So I get in regular contact with patients over there and try to understand what's happening and help them get resources if needed, right? So the advocacy work really is that I'm involved in raise awareness, right? Is one thing. Let people know about condition. Get to find as many patients as possible within the country, because with numbers, then it will be more patients. It will be easier to sort of ask for pharmaceutical companies to come into the country with a particular treatment. So that's what I'm mainly doing for my advocacy. So that is really why I hope in the near future more countries, especially Singapore, will get all these treatments available.